Welcome back to Dr. Sellars Educate. We're happy that you're back and we're thrilled to support you on your journey towards success. If you're now preparing for the CNE, CL, the CNE, or the CNE novice, you're in the right place. Make sure you go ahead and subscribe to this channel so you'll be alerted every single time there's a new episode. We're focusing on technology in nursing education for this snapshot. Question here is, does it have a role? We know that it absolutely does, so much so that Billings and Halstead has dedicated an entire unit in exploring some of the evidence-based strategies that we're going to talk about in this snapshot to ensure you're closing those gaps, primarily for competencies 1 and 2 as you get ready for the CNE exam. And then the CNE novice and the CNE clinical, there are different sub-competency areas as it relates to facilitation of learning that's very relevant for those specific exams as well. So let's go ahead and jump in and take a look. If you have Billings and Halstead out in front of you, that's awesome. We're focusing on chapter 20 to get us started. And in Dr. 𝗂𝘂𝗿𝘀𝗄𝗄's second edition review book, you probably know by now that each chapter is aligned with one of the CNE competencies. So we're looking at chapters 1 and 2 primarily as we talk about these evidence-based teaching strategies that are going to help support the facilitation of learning and the transference of comprehension associated with concepts that we teach our students in the classroom. First, let's talk a little bit about what the research says related to a supportive learning environment. First, we want to be knowledgeable about the evidence in the literature and what those effective teaching strategies are. We want to engage in active learning with our students, because we know that when students are more involved with their learning and thinking about Knoll's adult learning theory, they are more likely to retain the knowledge and, most importantly, in nursing programs, be able to apply those concepts that we're teaching them in the classroom. Congruence between the didactic and theoretical components and the clinical application processes are key to a nursing student success, not only in the NCLEX, but also in providing safe patient care. What are some of these what are some of these evidence-based strategies? Well, I'm glad you asked. They are centered around what we have seen in the literature called blended learning or hybrid learning. And in chapter 20, there are several examples and really explanations of the connected classroom, as they have titled it, using technology to promote learning with our students. There have been lots of changes in the healthcare information technology sector that has certainly prompted us to take a look at our curriculum to see if there are opportunities to improve some of the content and to align it better with the students' experience that they will see in the clinical setting. The connected classroom can include such experiences that include web conferencing. It can include some unfolding case studies, synchronous learning with our students, as well as problem-based learning. Each of these teaching strategies are going to allow our students to engage in more active learning opportunities, and it allows us as faculty to better assess students' actual cognitive ability to apply these concepts even before they are in a skills lab setting and in the clinical setting taking direct care of patients. When we talk about technology-based learning strategies, we are looking for them to be interactive. We know that in the online setting, that can be a challenge. However, with all of the great technologies such as Shadow Health and other textbook vendors that have launched simulations online, it does lend itself nicely to achieve some of these active teaching strategies that we're talking about. So that's the good news. The more challenging news for many of us is that we as faculty have to learn how to use these technologies, right? They're only as good, these excellent teaching strategies are only as good as we, as the facilitator of the knowledge, understand how they work, able to troubleshoot the technology, and to support our students to properly use the technology. We also want to make sure that we are aligning it with the evidence from the literature, all of our teaching strategies, to ensure that the teaching strategy is used in the appropriate setting. Those are going to include the classroom setting, the traditional classroom setting, the skills lab setting, and the clinical setting. Simulation is a wonderful opportunity for us to engage with our students to include scenarios and talking through those using either formative or summative evaluation. What you're going to find as you look in Billings and Halstead, and I'm going to go there with you, is that there is a dedicated chapter on teaching and learning using simulations, and that is in chapter 19 on page 353. You will find that in this chapter, it talks about the purpose of simulation, the role that simulation can play as experiential learning. Standardized patients, high fidelity mannequins really do offer student real life experiences of what they can expect to see in the clinical setting before they get there. So it can help decrease anxiety, decrease some of students' frustration because they know that they have faculty there to support their learning. Oftentimes programs develop what they call formative assessments. It allows students to understand concepts in a setting that is no harm to the patient, right? Because these are mannequins or standardized patients that students are conducting assessments on and even interventions. Okay, so that is formative assessment or formative evaluation. It allows students to make those mistakes and for us to coach students accordingly. So we're going to head and close out our time to get today together. But remember to tune in next week for our next episode. We thank you so much for joining, and we will see you in the next episode. Have a great one, everybody.